Yeah, the recording is on, and then I'll just do the 3 minutes. Yeah, and you can start, Doctor. There is a still, you see, you are seeing, yeah, Rizwan, you are seeing the case,
Yes,
yeah. So
yes,
just
I am.
be, yeah, because there is down below, there is more. So when you reach down
Mm-hmm,
below, let me know. And if
mm-hmm,
anyone
sure.
can, I'm so sorry, just 1 minute because I cannot see who wants to join. I will repeat the timing. Don't worry. It's just I can't see who wants to join, or if someone can volunteer to admit the people in the lobby, this will be easier. Let me try to put it here. Yeah. So I will repeat the 3 minutes for you. Okay. You are hearing me, yes? Because I'm
Yes.
not. Yeah, sure. That's good.
Sally, would you mind to scroll down,
Yeah, sure.
please?
Do. Yeah, sure.
Is it all or
Yeah, yeah, yeah.
okay?
You want me to
Would
bring
you,
it up?
yes, please. Yeah.
Sure. Do you want to discuss what you are thinking about, or you want to go
Yeah,
ahead?
it's up to you. I don't mind either.
Uh, well, your exam is next week, so
Yeah.
I think let's go ahead, yeah, and then
Yeah,
we
sure.
can
Sure.
discuss. Yeah, sure. Yeah, go ahead.
Hi, I'm Rizwana, one of the doctors calling from GP surgery. Am I speaking to Amer Omer?
Yeah, yeah, doctor. Thank you for calling.
Okay, so I believe our today's consultation is to discuss about your general health checkup. I could see some blood results as well. Am I right?
Yeah, doctor. Yeah, I think I received the invite through the post that they want,
Mm-hmm.
because I'm 40, that they want, to do a health checkup for me, just to make sure that everything is fine. And to be
Yeah.
honest, I feel completely fine. But then I was surprised that they want, the doctor to speak with me. I hope everything
Mm-hmm.
is fine, doctor.
Okay. Okay, definitely we could discuss together. I have got your blood test results in front of me, but is it okay if I ask you some general questions as I'm seeing you for the first time?
Yeah, sure, doctor.
Okay, you have mentioned the blood test was part of health check, but how are you
Yeah,
doing in general?
yeah, I'm completely like course. I'm completely fine.
Okay.
Yeah.
I could see as a part of general check, they check your height, weight, your blood pressure, and everything. And has it done like recently?
Sorry.
Was it
Uh,
done recently? The
yeah,
blood pressure
just
check and
just
everything.
from 2 days. 2 days,
Okay.
the nurse did did all the numbers, and then she took the
Okay.
blood, and
hmm
that's it.
Okay. So I found few things at your blood test. I'm just
Mhm.
going to discuss what I found so that I could correlate why I'm asking you those questions. Okay.
Yeah, sure, sure.
Okay. So in general, I found that we have checked your full blood count,
Mhm.
which showed that one of your blood marker we called neutrophil. So this blood
Mhm.
cell usually fights against any infection. Some are
Okay.
called neutrophil WBC count. So those fighting cell is a bit lower in your body at the moment. Okay.
Mm-hmm. Okay.
So,
Okay.
based on that, I need to ask you some question. As an example, if anyone has got recent infection, it could go low. Has it happened to you?
No, no, to be honest, I didn't get any infection recently, no.
hmm
No, but I
Okay.
really, to be honest, doctor, I rarely even have a common cold. I never become sick. Touch wood,
Mm,
doctor.
okay. It sounds you were quite healthy person.
Yeah, yeah.
Okay. Any fever recently?
No, no fever at all, doctor.
Any sore throat?
No, no sore throat.
Any cough?
No, no cough at all.
Any burning sensation during passing wee?
No,
Okay. Any changes in your bowel habit?
no at all.
Any night sweating?
No, doctor, also nothing.
Any lumps or bumps anywhere?
No.
Any unintentional weight loss? I have got your height and weight ratio, but just asking in general, any weight loss that you have
Well,
noticed?
I hope so, doctor.
Okay.
But yeah, I'm always in the higher, on the upper side little bit, but my
Mm,
weight is stationary.
okay. I could see from your records that you are taking omeprazole. Do you still take that medication?
Oh yeah, doctor, because I have, when I stop it, I get a very severe reflux. I got a severe.
Okay.
Please, doctors, if anyone opening his mic, if you can close it, please.
Okay. So, can you tell me
Okay.
a bit more about your heartburn?
What you want to know, doctor?
So, this reflux symptoms, how long that has been going on?
Well, I think it has been for a while now,
Mm-hmm.
but when I'm taking omeprazole is okay.
Salim, can you unmute yourself? Salim, I can't hear you. You are muted. Salim, can you unmute
Hello?
yourself? Yes, yeah,
Hello?
I can hear you now. Yeah.
Yeah, sorry, I thought I am muted. Oh, I'm so sorry. I don't know how this
No, no, it's
happened.
okay.
Yeah, yeah. I
So,
just, yeah, go ahead.
yeah. So when you have mentioned about reflux symptoms, can you tell me a bit more like how is your, what do you get with your reflux symptoms?
Well, yeah, usually it happen if I eat at night time
Mm-hmm.
late, and then
Mm-hmm.
I will have this, heartburn.
Mm-hmm.
But it has been a while since I took the omeprazole. It's
Mm-hmm.
fine.
And you are not getting any recent symptoms whilst taking omeprazole.
No, no, not at all. And even, I stop
Mm-hmm.
even though eating at nighttime, doctor. I eat,
Okay.
I
Okay.
eat before bed by five hours
Mm-hmm.
or so, and
Okay.
the things are
That's quite
fine. Yeah,
okay. That's quite good to hear. So I'm just trying to make sure how long you have been taking this omeprazole.
yeah, around a year now.
Yeah, now. Okay. Another thing I found your blood pressure is just borderline. So do you feel like any headache,
No, no,
any
no,
dizziness, lightheadedness,
no, doctor, no,
any chest pain at all?
no, no, not at all.
Okay. Some lifestyle factors could contribute to general health. Have you ever smoked?
Well, yeah, I smoked maybe 3, 4 years, but I stop it. I stop it, doctor. I'm trying,
That's very good.
once I approach the 40s, I stopped,
Mhm,
I stopped
mhm.
smoking.
Okay, that's very good that you stopped. Well done. How about drinking alcohol? Do you drink?
Well, alcohol occasionally only, doctor.
Okay. Can you give me a rough idea how many days in a week?
Well, no, no, it's not in a week. Usually, maybe I will meet with the mates every a month or so. We'll
Mhm.
go to central
Okay.
London and then we'll
hmm
we'll have a drink there.
Any recreational drug by any chance?
No, doctor, no.
Okay. In terms of your diet, you have mentioned about like late night diet sometimes causing your reflux symptoms.
Mhm.
Otherwise, how is your diet in general?
No, it's completely normal. I don't have problem. I'm taking healthy diet. I'm taking, fruits, vegetables. I'm
Mm.
eating meat. I'm eating even salmon
Mhm,
twice a week. So I'm trying to
mhm.
live healthy.
Oh, that's wonderful. Otherwise, physical exercise, do you do much exercise?
Yeah, I'm trying to work, to do exercise over the weekend. So Saturday, Sunday, I'm going
Mm-hmm,
for a 1 hour walk in each day. So
mm-hmm,
like 2 hours
hmm.
a week. Yeah.
Oh, very good. And what do you do for living?
Well, I'm a secretary, doctor.
Okay. And just trying to know, like, home situation, who do you live with?
I'm living with my wife.
Okay. Any family history of anything important that you think I need to know?
No, I don't think so, doctor.
Mm-hmm,
Everything, I
mm-hmm.
don't, we don't have any diseases running in the family. Everything I
Mm-hmm.
think is fine in the
Okay.
family. I
Any,
can't recall anything, to be honest, doctor.
okay. Any form of like cancer runs in the family?
Cancer? Uh, no, no, to be honest, no,
Okay.
doctor.
Mm-hmm. Mm-hmm. Uh, when I discussed about your blood test results, anything going on in the mind which could be like putting your immunity a bit low and causing this low neutrophil in your body?
To be honest, I don't know. It's just
Mm.
came as a surprise
Mhm.
for me, doctor. I'm not sure
Yeah.
why it. So, do you think my immunity is low now because of this
Mm.
cells?
So, like, I have described these both cells usually like fighting against infection. So, if any, that's the most commonest things happen when any infection going on in the body. Then this both cells could go a bit off on lower side. Otherwise, I'm just thinking anything in your mind that I could do today.
No, to be honest, I'm not sure. I
Mhm.
thought that you will tell me everything is fine and that's it.
Okay. Mhm.
Maybe my weight, if you can help me with, I'm not sure,
Definitely,
because I'm
definitely we will
trying, but
discuss. Hmm.
sure.
Okay. So, like, let's start with your this low neutrophil count.
Mhm.
I would like to write to hematology. They are the blood specialist. I would like to run through them just to figure it out, like why your blood count is quite low in your body. Okay,
Mhm.
like I said, it could be a sign of low immunity in the body. Okay, they
Mhm. Mhm.
might do few more tests to figure it out why the immunity low. Is that
Okay.
okay for you?
Yeah, yeah, sure, doctor.
Okay. In the meantime, if at any point you get any fever or any other signs of infection like cough or any burning sensation during passing wee or any other sorts of infection, sore throat, please contact us immediately because we need to check further.
Okay,
Okay.
sure, sure.
So you have mentioned that you need a bit of help with weight. We have got health and well-being coach in our GP surgery. How about if I'm doing a referral to them so that they could discuss more. You already told your diet is okay and you are trying to be physically active. Let's see if they could give you any other suggestions.
Okay, like what? What they can offer me, doctor? So, you mean
Uh,
medication? Would they be able to offer me some meds?
So the first line is always like as much as like continuing all those healthy diet and exercise that you have been doing. That's always as a first line. Yes, there is some medication to lower down the body, to lower down the weight. Okay, we called early start. But how about
Hmm.
if we are starting from a bit more like being healthy, and if it does not work, always medicine will be an option. And based on your weight, I think yes, medicine is an option. Which one you'd like to consider?
Well, perhaps maybe the tablet. How it's working, doctor?
So this medication is called Orlistat. If even you are on this medication, always we will advise to continue all your healthy lifestyle. This medicine is usually preventing fat absorption by our body. So it has
Hmm.
got some side effects as well, like
Hmm.
people might feel a bit of loose stool or fatty things going on when they are opening bowel. It
Okay.
very occasionally it could make a bit of we called bowel incontinence, but that's very
Oh,
occasionally it could happen. Okay.
okay. No, no. Then I think I will not. I will not use it now. I don't need to be incontinent. No,
Okay.
this is the last thing that I
Another
want.
thing I found that is
Hmm?
your blood pressure just borderline. Okay.
Yeah.
So is it okay if I give you a diary which we called
Hmm?
home blood pressure monitoring?
Yeah.
And it would be really good if you could do monitoring like twice in the morning and twice in the evening for consecutive 7 days. Do you have blood
Okay.
pressure monitoring at home?
Yeah, I can buy one. Obviously, I need,
Okay.
so I will buy one
Mm-hmm.
over Boots or
Mm-hmm.
something. Yeah.
Okay. Like I said, I will do an urgent referral to hematologist and I will call them as well. Let's see if they give me any plan or not. Okay. If they give me any plan, then I will get back to you. Is that okay
Okay.
for you?
Yeah, sure, doctor. Yeah, yeah, no problem
Okay.
at all.
Okay.
You will, how you will call me? Just shall I call you back, or we'll see each other next week?
If they ask anything urgent, I will call you today. Otherwise, in a week time.
Okay, sure,
Oh,
sure,
Salim,
doctor.
I lost
Sure.
myself.
No, no, that's fine. Why? You did, you did well, to be honest. Not bad, but just a few tweaks in the management. I know that it's not a familiar topic. Okay. So basically, yeah. So when you find a low neutrophil count and low white blood cells, this is something, yeah, it may be alarming, maybe not. You don't need
Mhm,
to bother the hematology suddenly, okay? Because if the patient is asymptomatic,
mhm,
is less likely that there is a major issue there. So we will discuss that. And good that you pick up the other two things. The BMI is a little bit on the higher side, okay, and perhaps the omeprazole, maybe he doesn't need it, okay, he may need it to take it on demand, okay, only,
mhm,
especially if his symptoms are controlled. Okay, no need to keep the patient on long-term omeprazole. Blood pressure borderline, yeah, well, it's fine if you want to repeat it. That's fine. Not wrong to give him blood pressure diary. That was okay. Good thinking from you. Although you can just repeat the blood pressure after, the next year or something. Okay, for when he is coming for another follow-up. But that's fine. I mean, you did, because it's not that,
and
it's just on the,
cholesterol
it's
was
just in
also
the normal.
borderline.
Yeah.
And
So
cholesterol was also borderline.
yeah, you are right. But then he's eager to lose weight, and he will do some,
Mm,
lifestyle. He will go for
changes.
further exercise, and but what you did is not wrong. Is my only concern is about the management plan of
Neutrophilia.
neutrophilia. Okay, and I didn't hear a
Mhm,
diagnosis. So you did say that your neutrophil count is low, but you need to say this is something called neutrophilia, and
mhm,
then explain. So if we take it from the beginning, yeah, the opening was excellent, to be honest. You did use the pre-existent information. You did say that I will ask a few questions about the possible differential, but I didn't hear some important things. So I didn't hear that if you are asking about, um, lumps or bumps. I didn't hear that, which is important, isn't it? You did ask about unintentional weight loss, but and then lumbar bumps, this is important. Frequent infection, you did ask, which is important. And very important thing in such cases, okay, you can see that his name is not, is not European descent name. Okay, so Omar, Amir Omar. So ethnicity in such cases is important. Okay, because the people that are originated from Africa and Black Caribbean and Middle Eastern and the Middle East people, okay, which most of us are from, okay, they have normally, normally neutropenia, okay, which is called
Okay.
which is, so I think you will alarm the things there without need. Okay, however, to know is not is it racial neutropenia or not, need to repetition. Okay, so the first
Mm-hmm.
step, I would be eager to know, does he have symptoms now or not? He doesn't have symptoms. He doesn't have fever. Okay, then it's not a neutropenic fever, which is an emergency. So you don't need to refer him now to the hospital. Okay.
Mm-hmm.
Then the other thing I would need to know, is he generally well or unwell, and there is any lumps or bumps in his body, and then
Mm-hmm.
that will exclude any other possible causes of cancers. Okay, or
Mm-hmm.
if there's any drug abuse or any drugs can, because a lot of drugs can cause low neutrophil. One of them is ranitidine, and that's why ranitidine was removed from the market. Okay, carbimazole, okay, antipsychotic, all of these medication can cause a bit of neutropenia. So if a case came with massive list of drugs, you need to make sure that you are not missing, drug causes of neutropenia. Okay.
Mm-hmm.
And then coming to the ethnicity, but ethnicity you cannot guarantee that this is an ethnic background of neutropenia, except if you repeat the blood test. So if what you are usually doing in your normal, normal case-to-case scenarios, you would do repeated blood test. Okay, I can see that your neutrophil is low. I'm pretty assured that your immunity is fine, but maybe we need to repeat your blood. Maybe you had subacute viral infection and didn't was not noticeable by you. So I would rather to repeat your blood tests, and then according to the neutrophil count. So if the neutrophil count is less than one, then you need to repeat the neutrophil count within 2 weeks. And if it's more than one, then you need to repeat the neutrophil count in a 6 weeks time. And then after you repeat the neutrophil count, then you will consider, if it's still there's persistent low neutropenia, then you need to refer him for the hematology and urgent cases or not. Okay. But if his blood, if his neutrophil count is improving, then you don't need to do anything. Okay.
Sorry, did you
Provide.
say second time if it is less than one, then it will be referral second
Yeah,
time?
yeah, yeah. Second time. Okay, I will show you now an algorithm. It's very, very easy algorithm. Okay, and if you go through it once or twice, and then everything will be fine. The other thing, when you repeat the full blood count, you need to exclude other things. So you will do, okay, you did the drug history. You would consider, doing folic acid and B12, because it can affect the neutrophil count, not only the MCV. Okay. You may consider, according to the symptoms, doing LDH, for ESR or CRP, and or serum electrophoresis, if you find that it might be something hidden there. So doing the blood is acceptable before doing the referral advice and guidance, because one single neutrophil low without any significant symptoms is not something that should be alarming. Okay, except if you have find symptoms. And my advice, if you have any patient with abnormal blood counts, okay, which can signify maybe there is a cancer or significant pathology there, I would strongly advise the patient to come. Let me see you face to face. Let me examine you. Make sure that there is no lumps or bumps there. Okay, because maybe they have large lymph node and he cannot feel it. So don't depend on the patient's story or the patient judgment in such a clinical vignette. Okay.
Yeah, sure.
Let me. So my only concern, yeah, the structure is fine. Okay, I don't have any problem with it. The only thing that I will take it on you, that I didn't hear about asking about his origin from where. And the other thing, when I said I'm drinking, I'm going once in central London drinking with the mates, you need to ask if he's binge drinking or not. Yeah, he's drinking once a month, but then he maybe go for binge drinking, and that will alarm that you need to, refer him to the alcohol services. Okay.
Yeah, sure.
Yeah. You did do the safety netting. Was that excellent? And then you manage the other things. The other things, I think, pretty good. You did explain what is the problem with the Orlistat, and that was, I don't have any concern with it. Keeping in mind, Orlistat per se can cause also the neutrophils to go down. So this one of the things that you might convince him not to use the Orlistat if he decide to use it. Okay,
Sure.
so in general, so neutropenia is any white blood cells less than 1.5. If it's more than that, usually it's insignificant. Okay, especially if there is no clinical vignette suggestive of any underlying pathology. Grading, yeah, if it's less than half, 0.05 is very severe, zero point 0.1 to 1 moderate or mild. The problem is it's less than one or more than one, because this will guide you when you should repeat the full blood count if he doesn't have symptoms. The differential wide variety of blood of drugs can cause it. I strongly advise that keep in mind the antipsychotic, okay? And the people who went for psychiatric rotation, they will know that any patient on clozapine that we are bringing him in monthly basis to check his full blood count and the safety meeting, if we have sore throat or something or common cold, he need to come to the inpatient and to do blood test, okay? Psychiatry inpatient. One of the other things is the sulfur drugs. Okay, so sulfonylurea, cotrimoxazole, sulfonamide. So these are the sulfur drugs, and for sure carbamazepine and carbimazole. Okay, these are very common drugs that we are using, plus the methotrexate. Ranitidine, it's difficult, to find some patient on ranitidine, except if he's coming from overseas. But you won't find someone in the UK on ranitidine because it's not in the market. Okay. Racial background, you ask about viral illnesses, rheumatological disease. Well, he already told you that I don't have any symptoms, so you can omit it. And then, sepsis, he already told you I'm fine. Okay. Coming to the algorithm. So if he's unwell, suspected neutropenic sepsis, urgent referral to the ED, and then according, if it's less than one or more than one. So both of them, if he's well and fine, if febrile, then you will repeat. The only difference is if it's less than one, you will repeat urgently within 2 weeks. And then if it's more than one, you will repeat in 6 weeks. And then if it's again less than one, and then you cannot find any cause, okay, but after doing the blood test, this will need an urgent referral to hematology. And if it's more than one and then still asymptomatic, then you can just repeat it every 6 months or every year. But if it's becoming less than one or any abnormal test, again, you need to refer him to urgent hematology. It's not an exhaustive algorithm. You can go through it, and I think it will be, it will make everything easier for you with a little bit of the investigation. And then bringing the patient in, please, okay, and examine him. You need to see if you have lymphadenopathy or splenomegaly. Is that clear up to now, doctors?
Sure. Yeah.
Yeah, yeah. This is the same repetition of what we say. And then the other things that can come, just have a look of what are the causes of lymphocytosis, neutrophil, a high neutrophil count, okay, leukemias, okay, low lymphocytes, or eosinophilias, what are the causes? Because full blood count is everyday investigation that you are seeing. So you can expect that they can ask in any abnormalities in the full blood count. Um, Causes of MCV, low or high, microcytic hypochromic anemia. You need also to what is the causes of it. So full blood count, please try to master it before entering to your exam. Not only for exam purposes only, also for day-to-day life. It's the most common a single investigation ordered in the, in the general practice. Okay. Neutropenic sepsis, yeah, usually the patient will be on chemotherapy or even within 6 months of the chemotherapy use. But again, if the patient have low neutrophils, high temperature, you need to go to treat him as neutropenic sepsis till proved otherwise and send him urgently to the hospital. The other thing, some people, especially some patient that, especially on chemotherapy. So even if he doesn't have fever, because some people will respond to sepsis with low temperature. So if patient on chemotherapy or was in chemotherapy or having problem with their immunity, like HIV patient, immunodeficiency patients, taking any rheumatological drugs. So these consider be an immunodeficient patient. So don't look only for the temperature. So if the patient in general become generally unwell, persistent abdominal pain, generalized fatigue, dryness, diarrhea, any illness can suggest infection. I will strongly advise you to refer him to the hospital, okay, to do an urgent full blood count and see his neutrophils because these patients can present atypically. Their neutropenic sepsis can present atypical. I think it's difficult something to appear in any exam with the neutropenic sepsis, but it's something you need to consider in your to day cases. Which you may find some of the cases you may meet one of the cases with neutropenic sepsis because so please don't omit it because it's extremely rapidly progressive and the patient will deteriorate rapidly. So just be aware about it. Uh, these are the first case. Okay. Does anyone have any concern or have any questions or have any feedback regarding the case? Or Rizwana, what do you think? There's one who's raising his hand. Oh, who's Dr. Z?
It's me, Saida.
Oh, Dr. Zeda. Yeah, go ahead.
Hi, Salim. I just want to ask, is it important to take the sexual history in this case for suspected HIV?
Yeah, could be. Yeah, you're right. Yeah, could be. But the issue is, I think there will be no time. But yeah, you could touch base on it. Yeah, which reasonably yes, it's one of the immunodeficiencies. Yeah. Yeah, definitely yes. If you have time, um, keep in mind, you don't need to exceed the data gathering more than 6 minutes. The first half more than 6 minutes because you need to cover the rest of the things. You may find if you find time, okay, well, you say, oh, I meant to ask you, I should have asked you about, sorry, if some, sensitive questions. Do you have any sexual encounter outside of your marriage? Do you have any encounter with sex worker? And just to make sure that you don't have any, this sexually transmitted disease can affect, your immunity. Yeah, that's good thinking, to be honest. Yeah. Is it clear? Fine. Any other thoughts, doctor? No? Okay, so I will stop the recording for the first case.